Ahead of 2 days of testimony in Salem, Representative Rob Noce began by saying this.
I know that this is a very big deal. This is probably one of the most important topics that we're going to wrestle with.
The topic in question, hospital staffing. The bill on the table would mandate nurse-to-patient ratios. The proposed legislation would ensure staffing levels were sufficient to allow workers to take meal and rest breaks. The ratios would vary by type of care and department. Hospitals could be fined or sued for not meeting those standards. Nurses argued it's not a matter of money. It's the unrelenting demands of the job.
We do not have a shortage of nurses. We have a shortage of nurses willing to work at the bedside in the current conditions.
Could you imagine what it feels like to be proficient and competent at a job you love, yet not have the ability to do your best because you're continually being pushed to do more and more by your employer?
You're pushing these people past their breaking point, and that should worry you.
Some said despite their dedication and years of work, they've left the bedside for good.
I felt exhausted, demoralized, worthless, gaslighted, then numb, apathetic, and suicidal. The most traumatic shifts that triggered my burnout were when we were understaffed. I developed overwhelming anxiety trying to juggle unsafe staff loads, safe medication administration, and trying to care for everyone at once with the care that they really needed.
Amid the passionate support for this legislation, chief nursing officers and other opponents from across the state said this bill is not the solution. President and CEO of the Oregon Association of Hospitals and Health Systems called it a dangerous experiment at the worst possible time.
The nurse staffing law needs to be modernized. It needs to work for today's environment. I am confident that together we can work to address these challenges. But this bill does not do those things.
We already aim to have the same standards that are being recommended. It's not from lack of trying.
And patients and their loved ones are going to lose if this bill passes.
All right, that's interesting, Alma. What exactly do hospitals mean when they say patients could lose out here?
Well, David, hospital admins are concerned. They might have to limit beds or reduce services if they can't hire enough staff to meet the ratios laid out in the bill. Lawmakers have about a month to work on it and move it out of committee. We'll continue to follow the developments here, and we'll have the full text of the bill linked on kgw.com.
Thank you, Alma.